All right, when you've been married a long time, you get to know what the other person thinks. See the gentleman's comment? No, you don't. Communication in relationships is so important. If you have been with someone in a partnership for 20 years, it doesn't make a difference. The only time my husband knows what I'm actually thinking is when I do the glare. He knows something went wrong. But he doesn't know what, right? He can't read my mind. We need to make sure we're asking for what we need and saying what we need. They can't read our mind. If you are in a partnership and you look at them longingly, they might just think you have gas. You need to tell them. So how can you do this? There's a simple formula that I love that the NIH put out, which is fact, belief, feeling, and action. You can do this with your friends. This is not just about your sexual relationships. So fact. You haven't initiated any kind of sexual intimacy in the past several months. Belief. I think that's because you don't think I don't desire it, or you don't find me attractive. Feeling. That makes me feel more isolated and alone when I can't connect to you in ways that we used to find pleasure. Now, I will say to the women in the room, typically we are really good at dumping that on our partner's laps. You don't touch me anymore, I think it's because you don't find me attractive, and it makes me really sad because I feel isolated. We're good, typically, at throwing that out. What we aren't so good at is telling them what we need them to do next. They cannot read our minds. We have to guide them in what we need them to do. And when we do, you can't then come back to them and say, you're only doing that because I told you to. Doesn't work that way. We have to guide our partners and our friends, right? So if we think about our intimate relationships, you don't call me anymore after my scans. I think it's because you don't know what to say if something came back not positive. That makes me feel more isolated and alone, and I feel like I can't talk to you about the things that are good or challenging in my life. And then in action, I need you to call me after my scans, even if it makes you feel uncomfortable, because I need you in that with me. Right? Give them fact, belief, feeling, and action. So another example, ever since I told you that I'm anxious about my follow-up test, you've stopped asking me how I'm doing or talking about non-cancer stuff. I think it's because you're worried that it will make me upset. That makes me feel more isolated and alone when I can't just have a normal conversation about life. So your life is important to me, and I would like for us to talk about non-cancer stuff often, and I need you to call me about the stupid things you used to call me about, right? How many of us have to remind our friends that we don't want to just be called about cancer stuff, that we want to listen to the other things, right? It's important. They don't know. They don't know what they don't know. It's ignorance. It's naivete. It's not because they don't love you. Cancer provides you an opportunity to evaluate your relationships, and it provides you an opportunity to evaluate the relationships in your life that are toxic. And it doesn't mean that you can take house, clear house, get rid of those, but it certainly does give you the opportunity to prioritize them. So choose wisely. Whether it's getting rid of or reassessing these toxic relationships, cancer can provide you an opportunity to clear out the people that suck you dry. You don't need to waste good energy and a good day trying to manage someone else's needs or trying to manage someone else's worry about you. So ask if your needs aren't being met, and if they can't respond, then that's another discussion. So it's not helpful when you say to me, everything's going to be okay, or everything happens for a reason. What I need from you is for you to listen and tell me this scares you too.